On today's episode on abortion, we're going to be talking about the difference between medical abortion and surgical abortion. First of all, what is medical abortion? Medical abortion simply means you are terminating the baby using medication, using drugs. While for surgical abortion, it simply requires some minor clinical procedure to actually take the baby out. It involves the use of suction or other instrument by the doctor. So in terms of medical abortion, it is usually done in the early stage of pregnancy. This is like 10 to 12 weeks of pregnancy, depending on like your hospital guidelines, depending on the country you are, the guidelines governing them in regards to abortion. While in terms of surgical abortion can be used for early pregnancy. It can also be used for the second trimester, depending on the guidelines. In simple terms, medical abortion can be used for early pregnancy, but cannot be used for like late pregnancy. But for surgical abortion, it can be used for late pregnancy. Then that takes us to the third difference I would like to share with you, and that is location. For medical abortion, this can be done at home. You don't need to go to the hospital, except you're going up to the hospital for follow-up. But for surgical abortion, it's usually done in the clinical settings as the doctors that needs to carry out the procedure. The other difference we're going to be talking about is the duration, how long. For medical abortion, it can take up to days to carry out this procedure. Like you take the medication, your body has to take its time to do its work. It can take hours to days. While for surgical abortion, it usually takes 5 to 15 minutes. It's a quick procedure and the abortion is done. But for medical, it takes hours. It takes days for it to get it sorted out. So before I go further, medical abortion can be started in the clinic and it has to end at home. But it can be done at home or in the clinic, not just in the home alone. So the other difference I would like to talk about is the use of anesthesia. So when it comes to medical type of abortion, there is no need for anesthesia. But for surgical type of abortion, there might be some local anesthesia given, there might be some general anesthesia given, depending on what is taking place and depending on the individual at that particular moment. Then that takes me to another difference, which is cramping and bleeding. When it comes to cramping and bleeding between medical abortion and surgical abortion, for medical abortion, the cramp is usually more, the bleeding is usually more compared to the surgical abortion. That bleeding, that pain may last from hours to days. But for surgical abortion, the pain is usually mild and they do this whole procedure under the effect of anesthesia. So cramping and bleeding is more for medical abortion than surgical abortion. And in terms of effectiveness between medical and surgical type of abortion, medical abortion is between 95 to 98% effective. Both of them are effective. You can see they are above 90% effective. While surgical abortion is over 99% effective. It is more effective than the medical type of abortion. So before abortion has to take place, there are a lot of things that needs to be taken into consideration. How long is the pregnancy? How old is the pregnancy? The clinical settings available nearby. They have to take note of the local guidelines, the rules guiding pregnancy in that vicinity, in that country, and in that environment. So that is why before any abortion is carried out, it is very important for you to consult your healthcare provider. It should be done with your healthcare provider aware. In case of any complication, you can easily go to the healthcare provider. Like I earlier said in episode 1, the complications are rare when it comes to safe abortion, especially when it is done in a proper healthcare setting. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. Bye and see you in our next video.